next technique is more going deeper into the muscle, and it's called kneading. It's like kneading a dough. Yeah. The proper name of it is Petrissagge, which means kneading in French. So, what do we need? We need muscles. Yeah. So where the muscles are, I want you to come close again. Yeah. And I want you to actually feel the spine here in the middle. Yeah. Do you all see it? Now the muscles are aligned on the side here and here. There are a lot of other muscles, but we'll start with them. This muscle called erector spinae muscle. What do you think they do?
They hold up the spine.
They erect the spine, yeah? So sometimes the muscle's name suggests what they do. Okay, so how do you knead them? Yeah? You basically, you start, your intention is going deeper than the skin. So you might need to feel them to start with. So I want you to feel the spine, and don't worry, you're not going to break the spine by just feeling it. And then I want you to go and feel the heel. Oop, I go over it, yeah? So this is where it is. And the other side, so I have two erector spinae, one on each side, yeah? Good. So now I start to knead it. I can do on the same side, so I can do alternating hands. Good. And I can do alternating hands on the other side, yeah? But still using the Tai Chi movement, so still move. I don't move with my shoulders, yeah? But with my lower body. So if I'll take it backward, I will be like that, doing that. Yeah? And I can do what's called ringing. Are you okay, Liz?
Yep.
Yeah? I can do ringing.
Ringing.
Ringing, like a ring.
Yeah.
Like there is a ring here. Yeah? Yeah. Do you see now how I move that? Yes? This is effleurage. Yeah? Kind of lighter. And Petrissagge, Jack, if you want to come here. Yes? Are you okay?
So, yeah.
Yeah? Yeah, so far we did alternating hands. Yeah? Ringing. Good. You can do like picking, almost like trying to pick the muscles. And almost like trying to lift it. It will be a lot easier when we do the muscles on the limbs. Do you see how you lift them? So you're moving the tissue. You're trying to move the tissue. Yeah? So effleurage, you actually glide on top. Petrissagge, you're trying to move the tissue. Yeah, good. Now, you can do the same thing with the base of your wrist. Now, you don't have to lift the fingers. You're just coming. And actually, there is a wave that goes with your body. And every time that you see that actually my head is kind of on top of that. If you can show the camera for, yeah? I'm very much almost leaning against them, yeah? So I come back to here. So this is the base of the wrist, or I can do the same thing, but with the tip of the fingers. Usually I like to do it with reinforced tip of the fingers. Now, when I go deeper, do you think it's more sensitive to the client?
Definitely, yes.
Yeah.
It
So
is.
if you go deep, it can be sensitive for them.
So you need to be very careful.
So what careful? What do you mean careful? Do you
how deep you can, can't really.
how deep you can go? So what we can do to ensure that we're not doing too much?
You
can ask them.
Ask them. Good.
Yeah.
Yeah. So you can ask them
How's the pressure?
how the pressure.
Yeah.
You know, usually the simplest way to ask how is the pressure? Can I go deeper? So how's the pressure, Lisa?
Yeah, that's fine.
Can I go deeper?
Can.
Okay. So I need to go deeper. If you feel that you don't know how to, don't worry about that. Leave it. We'll talk about how to apply more weight of your body. Okay. So this is finger kneading. My idea is to move the tissue as much as I can, and that would be the effleurage. Yes, just a reminder.
Now, what
Now-
happens with the muscle when you do that?
We'll talk after. Do you come and see, do you see the redness here? Yeah. That means that the blood circulation improves. Yeah. So that's a good sign. Yeah. It's also feel warmer. Yeah. Good. So you can do the finger kneading with one hand, two hands, or what's called reinforced hand. You can do the reinforced this way or that way. So there are plenty of application, and a lot of the time you kind of feel what's right for you to do. Yeah? So let's work from the beginning, yes? In terms of Petrissagge, what is the idea of Petrissagge?
Like kneading.
Move the
Muscle.
muscles. Good. Move the muscle tissue. Good. And you can do that. How do we call that?
That's
Alternating.
alternating.
Alternating hands. This one.
Ringing.
Good.
Kneading.
This is with what do I use?
The heel.
The heel of the base of the wrist. Yeah. This is with the base of the wrist.
Fingertips.
Reinforce.
Good.
Reinforce.
Is this tender, Lisa?
No.
No. Okay. Okay. Good. Good. Now, I would say that for now, that's all the Petrissagge technique I want to teach. Yeah? So, anything, Laura?
Isn't there one where you do this?
Oh, there are plenty. Which one do you mean?
Like you're sort of squeezing together,
This one? Like that?
more like sort of like a mountain.
Like
Not
that?
Not that intense. Just on the individual, like you squeeze here, then you squeeze
There are
there.
plenty. There are plenty. And there is no right and wrong, only if you move the tissue. That would be, you know, you're trying to be effective, not political correct. Yeah?
But
So they put,
That's what I
Possible.
like. It's-
yeah, so, you know, you are welcome to do that and we'll walk around. What is the effect of Petrissagge? What do you think the effect of it? If when you're moving the tissue,
loosening up the muscles.
loosening up the muscle?
Feels speed the blood circulation underneath.
Yes, and you can see the evidence,
Yeah.
yeah?
Warm up the skin.
Warming up.
The muscles.
Loosen up the skin.
And it's more like warming up the skin. The skin, you cannot loose it because there is no contraction into, but I understand what you're trying to say, of it feels supple, more supple. Yeah? And relaxing the client.
Mm.
Yeah? Can you reduce the pain if somebody's having sore muscles? If you do that? Not sure.
Not sure.
Leave it as a question mark, okay? Good. You feeling happy to start it?
But I
Yeah?
was going to ask because on the consultation with the client, she said that she has a lower back pain. So I was asking if you're going to concentrate
Fantastic.
your treatment on
To remember that, that's the good link to do. Yeah, so the consultation form, if I would really treat Lisa, I would try to concentrate on the right side of the muscle, of the lower back. And then, I don't know, see what it goes. Maybe it improves,
Sorry, yeah.
maybe not.
But you just said you're gonna just give her shoulder and neck massage.
No, and back,
And back.
and back, yes,
Okay.
because that's what I know.
All right.
Yeah.
Yeah.
But you didn't do the neck.
Not yet.
Not yet.
He said after lunch.
Wait, yeah. So we'll do the back, and then after that we'll take lunch break, and then after that we'll do the neck and shoulder. Okay? I think we're ready.
Alternating between effleurage and
Yes, thank you.
Petrissagge.
Thank you. So that's a good one to do the Petrissagge,
And then you can.
and then once in a while to come and kind of flush the whole area with a nice effleurage, and then few of these, and then because effleurage really is like a connective stroke that link between one technique to another one. So good question about it. And then that can take you while you're doing effleurage to the other side, and then you're ready to do on the other side.
And you
Yeah,
start
so-
with the Petrissagge and the other
And then you start Petrissagge, and then again you do a little bit of effleurage, and then you start the neck and shoulder, and then again effleurage to the whole back, because it's nice to just work on an area and then link it to the rest of the body. Yeah?
Could you do the alternating again?
Sometimes it's
like
called
a
figure of
side to
8.
side,
Yeah,
right?
but it's one hand and then the other one. You can do it also on the same side. Now, Petrissagge is a bit deeper, so what you see that my body coming and lean in. Yes, do you see that? Don't be afraid of just staying there. No, you can lean in and then lean in again. And then, so my body does like half circles, yes? Coming in and then go up, and then coming in and then back, okay? But it would take time for you to do it, so don't worry. Okay, starting, yeah? Good, you close that.